Congenital infections. It means that you get this disease by having unprotected sex with a person who is infected with syphilis. It means that you get this disease by having unprotected sex with a person who is infected with syphilis. You may also get infected by direct contact, touching or kissing, with a syphilis sort of an infected person. If a mother has syphilis during pregnancy and is not treated, she can pass it on to her baby. This disease can cause serious problems such as death for your baby. Congenital syphilis occurs when a baby is born with this disease. Syphilis is most often transmitted from mother to baby during pregnancy, but during vaginal delivery, if the baby has direct contact with a syphilis wound, it may be infected. If congenital syphilis is not treated properly, it may cause complications. Before birth, the complications of congenital syphilis are as follows. 1. Abortion. Miscarriages when a child dies in the womb before 20 weeks of pregnancy. 2. Premature birth. It is a premature birth, that is, before the 37th week of pregnancy. 3. Fetal growth restriction and low birth weight. It happens when the baby's weight does not increase to the amount it should be before birth. 4. Placenta and umbilical cord problems. The placenta provides food and oxygen to the fetus through the umbilical cord. Congenital syphilis may cause an enlarged placenta and swelling of the umbilical cord, which can cause problems with how they work to support the fetus in the womb. 5. Stillbirth. This is when the baby dies in the womb after 20 weeks of pregnancy. After birth, the complications of congenital syphilis are as follows. 1. Neonatal death. When the fetus dies under 28 days old. 2. Fever. 3. Problems related to liver and spleen, such as jaundice, and enlarged liver and spleen. 4. Anemia. 5. Wounds in the mouth, genitals, anus, or on the heels, hands, and face. 6. Runny nose. 7. Meningitis or infection and swelling of the brain and spinal cord. 8. Problems related to joints and bones, such as pain, swelling, and changes in the shape of the nose and teeth. 9. Vision problems. 10. Hearing problems. 11. Problems related to the nervous system, including paralysis of the hands and feet and convulsions. 12. Developmental delay in the child's activities, when we expect him to do them at a certain age, such as sitting, walking, talking, social abilities, and thinking power. In the late 1890s, Edvard Munch, a prominent Norwegian painter of the expressionist style, based on what he saw during a visit to St. Louis Hospital, one of the 3 hospitals accepting people suffering from syphilis in Paris, created an artwork entitled Inheritance and the Subject of Congenital Syphilis. Munch, who was an expressionist artist, used sharp and exciting colors, frequent and turbulent brushstrokes, and profoundly distorted and out-of-frame shapes to induce sad and frightening emotions, and removed every element that was soothing and pleasing to the eye. This artist of the expressionist school did not have good mental health due to his childhood with anxiety and illness, so most of Munch's paintings were created on the axis of morbidity and suffering. Therefore, when he saw a baby with syphilis in the hospital, the feeling of sympathy that this baby was born sick like him made him create a painting of Inheritance. Munch depicted a newborn with congenital syphilis in his mother's arms, with open eyes, a yellow and pale face, and a body covered with reddish papules and nodules and disproportionate body parts, which indicated a sick and helpless infant. Innocent baby in her lap on the white sheet points to Pieta. Munch's own description of his painting was as follows. The woman bends over the child which is infected by the sins of the fathers. It lies in the lap of the mother. The mother bends over it and weeps so that her face becomes scarlet red. The red, tear-swollen, distorted face contrasts strongly with the linen white face of the child in the green background. The child stares with big, deep eyes at a world into which it has come involuntarily. Sick, anxious, and questioning does it look out into the room, wondering about the land of agony into which it has entered, asking, already? Why?